I guess I have the pleasure of being Debbie Condrey today, so I will do that. I am Debbie. I'm Condrey. I'm the CIO of the Health Department. And as Michael was mentioning, I'm going to pull this down just a little bit. He's a lot taller than I am, so I'm going to pull this down. As Michael was mentioning, VDH has had sort of governance responsibility for the creation of the All Payer Claims database. And it's sort of a natural fit for us. Some of you may know we also house the implementation of the Health Information Exchange. So we have a lot going on in the Health Department in regards to data. And obviously we're pretty excited about this ourselves because we're certainly a key stakeholder and user of the data as well. So I do have a couple of questions and a couple of issues I'm going to cover today, mainly that has to do with our role in the creation of the APCD. And I'm sort of going to go through that pretty quickly. Michael covered some of that information, but I'm just going to give you a little bit more in-depth discussion on how we're sort of managing the implementation of this project. And then the steps taken to facilitate the implementation, and then how we're going to use the data from the APCD for public health uses. Okay, whoops. So when the gentleman wired up the mic, he said you push a black button if you're going to panic. So obviously, immediately I want to push the black button just to see what happens, but I won't do that. So a couple of things that, just to start with, as Michael mentioned, the legislation created the APCD in the 2012 session. As he did mention, the implementation started off, the bill started off as a mandatory implementation, and with negotiations with the legislators and other stakeholders, we landed on a voluntary implementation, which does present its challenges. As Michael mentioned, 14 other states have APCDs in progress, and some of those are mandatory and a few of them are voluntary. And in conversations with the folks who are doing the voluntary implementations, they do present a few more challenges, but we in Virginia have, as we always do, have worked very effectively, in my opinion, through that, and I think we'll have a very successful implementation. So I want to read to you just real quickly, and I typically don't read from slides, but I do want to read the words that actually come from the legislation to create the APCD. And it describes the purpose of the APCD as created to facilitate data-driven, evidence-based improvements in access, quality, and cost of healthcare, and promote and improve the public health through the understanding of healthcare expenditure patterns and operation and performance of healthcare systems. So the legislators were pretty specific in some areas with the law, and in other areas a little bit more open, but there is a definite description and definition of what we should use an APCD for. Again, the implementation, the legislation does name the Department of Health and the commissioner, the state commissioner of health, as the overseer, sort of governance provider for the creation of the APCD. And it does direct, the legislation does direct the commissioner to enter into a contract with a nonprofit. This makes this convenient for us because Department of Health has had a very good relationship and contractual relationship with VHI for 15 or 16 years. So we basically took the existing contract, modified it to enter all of the pieces of the creation of the APCD, and off we go from there. So we did have a little bit of a piece of that to work on during this past summer when the law was signed, and we've been effective in getting that done, so we're moving along on that as well. The commissioner also in the health department were named as having the responsibility to ensure that standard data submission and use agreements are created with each entity that's submitting data and each entity that will actually use the data. And we've been working on that since the law has been signed. And as Michael mentioned, we are very close to completing that. We do have data use and submission agreements that are complete and are being rotated among the various stakeholders for signature at the moment. Additionally, the commissioner and the Department of Health were directed to appoint an advisory committee to assist in the formation and implementation of the APCD. Just a little bit about that. We've spent, again, a good amount of time sort of having conversations with various stakeholders and making sure we've got representation on the APCD advisory committee for all stakeholder groups. We probably have, this committee has been named, and we have about 22 people on the committee. We do anticipate breaking that down into subgroups as we start working through some of the issues. All of those people, as I mentioned, have been named and accepted, and we anticipate having our first advisory committee meeting sometime in late February, early March timeframe. The final piece of, one of the final pieces of the legislation calls for us, and this is sort of separate and apart from the APCD in some respects, but we are required to set up a working group with VHI that sort of looks at all of healthcare data and determines whether or not some of these data that are being collected can now be consolidated since we are collecting through the APCD. I mean, the goal is certainly not to collect duplicate and triplicate times, so we want to look at that at the back end of this to see if we can consolidate some of that data. And the final piece of this that's pretty key, and what we're working on right now that Michael mentioned, is by December 1st, and obviously today is December 6th, so we do have a report that's at the Secretary's office being reviewed there and expected to be public pretty soon. I will say too, and as I mentioned, the Secretary and the administration has been extremely interested in the implementation of this project and has kept really close contact with me and with others with the stakeholders, ensuring that things are moving along properly and smoothly. So we've had a lot of good support there. But the report that have been working on to get to the General Assembly and to the Governor by December 1st is we had to report to the Governor and the GA, as I mentioned, on whether those entities, and this is again specifically from the law, electing to participate as a data supplier have executed agreements to submit claims data representing at least 75% of privately insured individuals and individuals covered under self-funded group health plans in the Commonwealth. So our report basically describes the process we've been through to get where we are, and also gives the Governor and the General Assembly that information on that key 75% number. And I'm happy to say that we are there, and everything looks good with that. As Michael mentioned, one other piece of this that was not really named in the legislation itself, but was one of the key pieces to creating the APCD, and that was the creation of the participation agreement. And we started off calling this a founder's agreement. And it really was created for two purposes: to establish participation and commitment to the APCD, and to establish that sort of funding mechanism that Michael mentioned earlier. And the legislators and the stakeholders during the negotiation process last year, or this year, during the General Assembly, did agree that the plans would finance 40%, and the Hospital Association would finance 40%, and the Virginia Health Information would come in at 20%. A little bit more about the advisory committee. As I mentioned, we've worked to ensure that we have stakeholder involvement, and we've made sure that we've got representation for every stakeholder group. Some of the folks, the stakeholders are listed there. We've got representation from the business, consumers, health plans, hospitals, physicians, state nursing facilities, and experts in public health and public health reporting. And as I mentioned, the advisory committee has been named and will begin meeting in February-March timeframe. So how will VDH use the APCD information and the data coming from that? How the claims data will be submitted and used, of course, is of utmost importance to the success of the APCD. So we've spent a good deal of time with the stakeholder groups explaining and trying to get a good understanding of what data will be submitted and how that data will be used. And again, those data use and submission agreements that have been created define that really specifically. The code itself describes 3 general uses for the APCD, and again, they are sort of general, and we've tried to sort of narrow those down a little bit in our discussions while we've been working on these data usage and submission agreements. One of the uses that's named in the code is to improve public health surveillance and population health, including reports on injuries, chronic diseases, health conditions of pregnant women, infants and children, and geographic and demographic information for use in community health assessments, prevention education, and public health improvement. Pretty broad, but there's a good deal of information and data that the health department can glean out of the APCD databases that will help with that and help move us toward improving health outcomes. Michael showed a little bit about this, but this is the APCD timeframe from the health department's perspective, which is VHI's perspective as well, right? So we do anticipate starting the advisory committee meetings again this spring. We are working toward getting those data use and submission agreements signed. And in the January, February, March timeframe, VHI will begin looking for a vendor to do the analytics and the data collection. And we'll be moving toward data cleansing and start looking at data flowing next fall with the information available in 2014. Thank you.